Okay, so my name is Christian Gutierrez, an MS2 at TTUHSC School of Medicine, and welcome to a very special presentation of TTAP and Dermatology, where I'll be speaking about the various wonderful experience I had throughout my time at our very own derm clinic. So first off, I'd just like to thank Ms. Irma Garza. Very special thank you for taking time out of your day and fitting me into the monthly rotator schedule. Now, the first thing I'd like to do is, before moving on, is to take a special moment to appreciate the science of building rapport. I was blessed to have the opportunity to work one-on-one with all the doctors for 8 months. Went from being a very shy med student, afraid to move an inch, to sharing the joy of the engagements that they were in, and even getting the 411 on the latest skincare products. Additionally, I was able to observe Dr. Tarbox and Dr. Stetson in their natural habitats. From the beginning, I was able to see that their bedside manner was second to none. Dr. Stetson giving stickers to make the kiddos feel more relaxed, and Dr. Tarbox gracefully dancing in every room to greet every patient with her iconic "hello." While in clinic, I was able to document well over 40 skin lesions, including their presentation, symptomatology, and even treatment modalities. Additionally, I read over Principles of Derm, which is the recommended fourth-year supplemental text for rotating students. I also managed to study the flashcards provided to me by the derm department, and today I can't go over all 40 lesions, but I'll go over the 3 that left the greatest impression on me. So first, we have solar actinic purpura, very common amongst the elderly. It presents with dark purple blotches around the face, neck, and hands, and all you have to do to treat this is apply a natural sunscreen and just something that uses UVA, UVB for that barrier protection to help with prevention. Next, we have limited scleroderma, also known as CREST syndrome, which presents with calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyl, and telangiectasias. Treatment varies depending on what symptoms you present with and can include immunosuppressants, vasodilators, heartburn medication, and let's say you have Raynaud's phenomenon, for example. Well, some lifestyle changes can include cutting down on that stress and smoking. Next, of course, we have acne vulgaris. So I've battled personally with acne for about 14 years and have even been on Accutane for over 10 years. And I consider myself, I guess, somewhat of an expert on it. So symptoms include papules, nodules, blackheads, pustules, and cystic acne. The treatment depends on the severity of the disease. So if you have mild severity, then you would probably use glycolic acid and benzoyl peroxide. If it's moderate, then a tretinoin cream and antibiotics like doxycycline. And if it's severe enough, then, well, you'll be joining me in the Accutane Club, also known as isotretinoin, the systemic version of tretinoin cream. So next we have general dermatology, where it's one of the fields of dermatology that I gained a very good predilection for, and it took a very Gregory House POV in my 8th month stay there, where I was able to see the most diagnostics and treatment plans over a long period of time. Loved it. 12 out of 10. Next, we have Mohs surgery, which is pretty straightforward. I witnessed lots of large cysts, melanomas, and abscesses, and much more being excised from surprising parts of the body, to say the least. If you have a passion for dermatology and surgery, this is for you. 9 out of 10. Finally, we have cosmetics. Of course, there will always be a special place in my heart due to my surplus of a 10-year-old battle with acne, but seeing relatively newer methods such as lasers and microneedling being incorporated gives me a sense of comfort that newer generations won't have to put up with scars that, to be honest, acne left me with, both emotional and physical. Anyway, 10 out of 10. Lastly, I have the opportunity to talk about the research I conducted with Dr. Tarbox on gunshot wound care for low-income patients. Currently, it's in the process of being reviewed by the Cutest Journal, and fingers crossed, I'll be receiving my very first publication. With much gratitude in my heart, thank you, Dr. Tarbox, and thank you, Dr. Campbell, for such a life-changing experience and the first of its kind at TTU HSC.